So, good evening, everyone. First and foremost, thank you so much to the warm IMA welcome. And I have learned a lot of already pearls of wisdom from them, and I'm sure it will help me in my future as well. So, thank you so much. And let me just begin with this presentation. So, introduction, like all of us know, all of us are like very hyper as doctors. I think 10 साल तक पढ़ाई करते करते हम लोग थोड़ा पेन और पेपर को लेकर एलर्जिक हो जाते हैं. सो जब भी हम लोगों को बोला जाता है कि यू नीड टू डू पेपर वर्क, यू नीड टू डू पेपर वर्क, हम लोग ये सोचते हैं कि क्लिनिकल कब करेंगे, पेपर वर्क कब करेंगे, क्या क्या मेंटेन करेंगे. सो इट्स लाइक अ फोबिया फॉर ऑल ऑफ अस डॉक्टर्स. But please understand that medical documentation has to be accurate and it has to be a timely recording of the patient information. Whatever you are doing for your patient, all of us need to understand that nobody is coming to see the effort that you are putting for your patient. Nobody understands the amount of time that you have given. Nobody has seen that you've been giving CPR for that past 45 minutes or 1 hour to that patient. But everybody sees that the result is that the patient has not survived. So it is important that whenever we are doing anything, we see to it that we have documented it well. Because what we have done, nobody has seen, but what we have written, everybody will read for the years to come. So all of us need to understand that not knowing law is by no means any defense for us. It's like, मुझे नहीं पता था कि इतने साल रिकॉर्ड रखने हैं, या मुझे नहीं पता था कि ये भी डॉक्यूमेंट करना है. This sort of a defense, when we hear from doctors, it becomes a little difficult for us to even defend our own friends. So kindly let us understand that medical documentation we are doing is for ourselves. It's not for others. It's for our defense. So that is the importance of it. If we start looking at it at the perspective that we need it, that is the time when we'll be very, very serious about it. So when we look at medical documentation, the most important part I feel is that by doing the documentation, you are giving a continuity of your treatment. Second, when you are mentioning everything on your paper, you're actually making it understood. What were your differential diagnoses? What were the different investigations that you have mentioned? What are you looking at? Even if the patient discontinues treatment with you, the next doctor understands, okay, so this person has been working on it on this aspect. So this will only happen if your records are showing it. So the records are showing your continuity of treatment, your diagnosis, your differential diagnosis, and above everything, this is your legal defense. No document is no defense. Little document is little defense. So now it's on us to think and realize how strong we want our defense to be. The better the documentation, the better the defense. So many a times it's like, मुझे defense की जरूरत क्या है? Defense की जरूरत इसलिए है क्योंकि जब patient को ऐसा लगे कि आपने जो best दिया that was not enough, तब आपको prove करना पड़ेगा. और जब आपको prove करना पड़ेगा, तब आपको सिर्फ पेपर वर्क ही बता सकता है कि आपने कितना किया है. So it's very important. Now, what are the different components? What are the different papers that we need to have? Patient identification, यानी जो बहुत बार हमने देखा है कि जब पेपर्स लोग बोलते हैं कि मैम जस्ट चेक द डॉक्यूमेंट्स, दे फील कि फर्स्ट पेज एडमिशन पेज देखना क्या इंपॉर्टेंट है. Patient identification is also important. The history what the patient has given you is important. Your first hand findings, like many times I'm a gynecologist, जब भी मेरे पास केस आता है, my first question is, ma'am, was that patient registered with you or unregistered? आपके लायबिलिटी में वर्ल्ड ऑफ डिफरेंस आ जाता है जब आपने वो पेशेंट पहली बार इमरजेंसी में देखा है और जब वो पेशेंट आपकी रजिस्टर्ड पेशेंट है. Investigations and results, what were your diagnosis, whether it is provisional, final, what were the different treatment and procedures that you have advised or you have done. Either. It is not that, please mention it on paper. And progress and follow-up notes. Many times when the patient, सोचो third, fourth day जब post operative हो जाता है ना, तो हमारे notes क्या रहते हैं? GC fair, CT all. Please do not do it. आपने टाइम लिया, आप वार्ड में गए, आपने पेशेंट से बात किया, आपने पर एब्डोमेन देखा, यूट्रस कॉन्ट्रैक्टेड तो देखा, पल्स देखा. Please mention all of it. That shows the care that you are giving. The most important part for us as doctors is the standard of care that we give our patients. So please see to it that when you see your paper, na, समझना चाहिए कि यार has given immaterial of the outcome. Many of us are totally concentrating on the outcome all the time. Outcome आपके हाथ का नहीं है, effort आपके हाथ का है. तो जो चीज आपकी है वो आप दिखाइए तो सही, आप लिखो तो सही, तब उसका मजा आएगा. Very, very important is the seventh point. That is the consent forms and the discharge summary. I'm sure consent पे तो n number of medical legal lectures आपने सुने होंगे. But I'm telling you, n raised to infinity भी आपने कर लिया consent form में, तो भी उसकी importance उतनी ही रह जाएगी. You can never be saturated with the knowledge of consent forms. And discharge summary. बहुत बार we have seen that patients get discharged from the counter, from the reception. They are just given a document or they may not be mentioning anything on the paper. It's really very important to mention क्योंकि जो आप पेशेंट को बोल रहे हो ना फॉलो अप आफ्टर 5 days, वो आपने लिखा नहीं है तो यू विल नेवर बी एबल टू प्रूव कि मैंने बुलाया था पेशेंट को 5 days के बाद. So please see to it that whatever you are telling the patient, follow up in case of bleeding. Please mention it there. Follow up in case of bleeding, in case of pain abdomen. एक सिंपल प्रोसीजर भी रहे तो भी आप मेंशन करें. Informed consent. I know you must be having a lot of it, but just I'll go through it. Just let us understand the concept of informed consent. First and foremost, it is not a form. जो हम लोग बोलते हैं ना रिसेप्शन पे वो फॉर्म है वो साइन कर दो, नहीं है वो. It is more than just a signature on paper. Informed consent is a communication. It is a process कि आपने पेशेंट को इतना टाइम दिया, आपने उसको क्या समझाया, डायग्नोसिस समझाया, उसको ऑप्शंस ऑफ ट्रीटमेंट बताए, वो ट्रीटमेंट के क्या क्या कॉम्प्लिकेशंस हो सकते हैं वो बताए, और अगर उसने कोई ट्रीटमेंट नहीं भी किया तो भी क्या होगा. These are the things which have to be mentioned. This is what is an informed consent. And here I would like to highlight one more point. Please remember, consent is like an agreement. और अग्रीमेंट सिर्फ तभी वैलिड होता है जब दोनों पार्टीज के साइन होते हैं उस पे. वी हैव सीन अ नंबर ऑफ पेपर्स जहां पे डॉक्टर का साइन ही नहीं होता कंसेंट पे, सिर्फ पेशेंट का होता है. एंड नंबर ऑफ केसेस हैव बीन लॉस्ट इन द कोर्ट in spite of no negligence, but because there is no signature on the consent paper saying that this is not a valid consent. So please see to it that your signatures, your timing, your date appears very silly, sounds very silly कि यार ये क्यों बोल रही है ये चीज, लेकिन ये चीज अगर आप याद रखोगे ना 50% of your war is won. That is the time when the preciseness of your whole paperwork is seen very clearly. So that is something that you need to do. Now, what will we say as principles of good documentation? Number one, accuracy and completeness. In the sense, the papers should be very accurate with time. Please remember, date के साथ time होना जरूरी है. And time में AM, PM होना जरूरी है because we do not write 13 and 14 and 15. So please mention in AM, PM, write the date and always mention who is seeing the patient. Seen by. इतना लिखने की आदत बनाइए. Timely and chronological entries. Many times हम लोग पेशेंट को डील करते हैं, हमको टाइम नहीं मिलता है, we do paperwork later. लेकिन see to it that you manage your chronology is maintained. That is not compromised. वेरी वेरी इंपॉर्टेंट पॉइंट कि जो चीज हम लोगों के डिफेंस की है, जो चीज हम बना रहे हैं, जो चीज हम लिख कर रहे हैं, जो चीज हम सेव कर रहे हैं, सब कुछ कर रहे हैं, लेकिन उसको पढ़ना भी तो आना चाहिए. When there is a crisis, हमारी हालत ऐसी है कि हम लोग ही खुद की हैंडराइटिंग नहीं पढ़ पाते. So writing in a legible handwriting or having electronic records and everything as far as possible should be factual. आपने एक manipulation कर दिया ना, the whole thing looks manipulated. So try to do everything factual and maintain confidentiality at all times. This is really important. For whatever reason, Please see to it that the patient's confidentiality is maintained. Now, these are a few newspaper cuttings. आप लोगों ने न्यूज़पेपर में देखा होगा, अपने सब स्टेट्स है इसमें. There was a very interesting case in the Aurangabad bench. तो वहां पे there was an injury certificate that was given to the duty medical officer by the court. Judge said कि आप बोलो अभी इनका क्या injury है. And he took the certificate and couldn't read it. So the judge got angry. He said, who has done this? He says, I have only done it. And he cannot read his handwriting. So because the judge got annoyed, he called the principal secretary health to the court. And the principal secretary health was all the more annoyed. कि आप मुझे कैसे बुला सकते हो? Since for this injury certificate. He says, why should I read an injury certificate? He says, because your doctor cannot read it. And we have not called you pass a rule that when a doctor's handwriting cannot be read, he should be fined 5,000 rupees. बहुत सारे डॉक्टर्स ने जब मैं लेक्चर में बोलती हूँ 5,000 रुपीज बोलते हाँ चलेगा परवड़ेगा you know that sort of a thing, but please understand it's real, so lightly. So this is our doctors, right? All of us know. जैसे डिग्री बढ़ जाती है वैसे ही हैंडराइटिंग ढीला 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 हो जाता है. एंड इट इज लाइक अगर अच्छा हैंडराइटिंग है तो आज फार्मासिस्ट भी बोलने लग गए ये शायद ज्यादा पढ़ा लिखा नहीं है क्योंकि इसका हैंडराइटिंग बहुत क्लियर है. So this is a thing that we need to change. Gone are the days कि जब डॉक्टर गर्लफ्रेंड को लेटर लिखेगा तो फार्मासिस्ट से पढ़ा लो करके हम लोग हंसते थे. अभी it's not done. According to medical code of ethics, we are supposed to write legibly. We're supposed to write in bold. And they say that there are at least 7,000 deaths every year due to bad handwriting. I feel even to show that the patient is alive, एक ECG में up and down लगता है. तो हमारी हैंडराइटिंग ऐसे कैसे रह जाती है कि एक कौवा कहीं उड़ रहा है और 2 ड्रॉपिंग्स नीचे डाल दिया. हाँ, ये या तो एक स्ट्रेट लाइन ऊपर गया एंड देन देयर इज वन छोटा सा लाइन जो नीचे आ जाता है और वो सिग्नेचर बन जाता है. we need to overcome all these things. Please understand, by writing neatly, by writing legibly, आपकी क्वालिफिकेशन कम नहीं होगी, you'll be more appreciated. So make it a point to see that your handwriting is very legible. Of course, अभी तो आपके पास ऑप्शन है कि you can go into electronic records. दोनों के हैं, but that option is really there. Now, type of medical records. It can be either paper-based, or it can be electronic medical records, or it can be electronic health records. So, electronic medical records are when the records are maintained in a single setup. Health records are when you are having satellite centers. जैसे अभी 2-4 हॉस्पिटल्स हैं, उसकी एक सर्वर होगा और वही सर्वर पे अगर रहा तो that will be together. So those are totally health records. Now we look at confidentiality. बहुत बार हम लोगों को इसमें बहुत प्रॉब्लम आता है. इसलिए प्रॉब्लम आता है because number of times we are asked to produce the papers. जैसे हस्बैंड एंड वाइफ में झगड़ा हो गया तो आके बोलते हैं कि हम लोगों को चाहिए. So we have to understand what we have to do. So we have to give limited access to only authorized personnel. And please remember, अगर कोर्ट ने पूछा है या कोई ऑफिशियल ने पूछा है या कोई पुलिस ने पूछा है तो we have to give. I don't think we have the choice. See that all your records, whether they are physical or electronic, they are in a safe storage. Far as possible, try to use passwords and encryption for digital data. And if you need to give your documents, if you have to do the disclosure, see to it that it is given only with the patient's consent or with any legal order. So see to it that the confidentiality is totally maintained. Now let's look at one more part, that's the document retention. So OPD papers need to be there for 3 years. IPD, if you are having digital, then you can keep it for a longer time. Physical, 3 years. MLC till the finalization of case. Pediatric cases, 21 years. Till the child is mature, 18 years plus 3 years. Birth and death, forever. Casualty, OT for 30 years. MTP and biomedical waste, 5 years till the end of calendar year. So calendar year would be from January to December. and ART 5 years. This is what the NMC says. Difficult, but we need to keep. I'm sorry, it's gone ahead. Here, I would like to highlight that in case now your OPD or your IPD papers are 3 years old, but in case you're having, obstetric patients, your babies are having birth asphyxia. There are cases where the babies have had birth asphyxia, and after the baby has realized that the baby is having a problem, delay or learning issues, then at that time they have come for documents, and our doctors have answered that documents are not available because 3 years ho chuka hai. So please see to it that critical cases, you maintain your papers. As far as the routine cases go, if you want to destroy the papers, you have to give a public notice in 2 newspapers, one local, one national, and give them a time of 15 days if documents. Keep it with you. Even that is a proof for you. Okay. So now what are the common documentation errors? Incomplete or delayed entries. This is quite common because when we are dealing with emergencies, we don't have the time to take a paper and pen and sit and do it. But then it is important. Missing the date and signature. जैसा वो अजय देवगन वाला मूवी था, बैक डेट में एक डेट किसी ने बोल दिया दृश्यम, तो वैसा ही वो ही दिमाग में रह जाएगा 4 तारीख 4 तारीख 4 तारीख और आगे का सब कुछ भूल जाएंगे. So see to it that you mention it there. यूज ऑफ एम्बिगुअस एब्रीविएशंस. बहुत लोग हम लोग अपने खुद के एब्रीविएशंस बनाते हैं. प्लीज डॉक्यूमेंट में यूज मत करिए, क्योंकि जो कॉमन एब्रीविएशंस है, जो आपके एब्रीविएशंस है, सामने वाला शायद वैसे ही उसको नहीं पढ़े. तो डू नॉट यूज एम्बिगुअस एब्रीविएशंस. ओके, व्हाट आर न्यूट्रल आर ओके. रेट्रोस्पेक्टिव एंट्रीज विदाउट जस्टिफिकेशंस. जस्ट ऐसे ही थोड़ा ये लिख दूंगा तो मेरा डिफेंस स्ट्रांग हो जाएगा या मेरा पेपर वो बेटर दी. So the more you try, that's why I said even a small manipulation, actually they lose the confidence in you. So don't do it. Now this is one study which I would like to share with all of you. This was a study between 2015 to 19. 245 medical negligence cases थे. उसमें से 126 केसेस में कॉम्पेंसेशन दिया गया. आउट ऑफ 126 केसेस, 37 केसेस वर बिकॉज ऑफ डेफिशिएंसी इन डॉक्यूमेंटेशन. जैसा C15.3% जो है वो मिस्ड एंट्री था, मेडिकल रिकॉर्ड्स में मिस्ड एंट्री. देन देयर वाज 8% ड्यू टू कंसेंट फॉर्म्स, डेफिशिएंट कंसेंट. मेडिकल रिकॉर्ड्स टोटली 7%. Again, deficiency in discharge summary, 6%. Error in entry, 3%. Wrong reporting in around 2%. And tampering with 126 में से 37 cases are only because of documentation. When I went through it, I felt कि ये 37 cases maybe उनकी तरफ से कोई medical negligence हुआ ही नहीं है. The negligence is only that they have not documented their effort. 37 cases could have been avoided. 37 of our colleagues would have not gone through this stress. So that is very important. That is very important. So we all need to remember that poor documentation can make a good care look bad. That is other problem. कि हमने सब कुछ कर लिया, लेकिन वो देखते वक्त तो बुरा ही दिखा. That is the problem. Now, what are the best practices? Number 1, record the data immediately after care. क्योंकि आप immediately करोगे, आप fresh रहोगे, आपको सब याद रहेगा, आप अच्छे से लिखोगे, आप कुछ skip नहीं करोगे. आपने जितना effort डाला है वो आपके पेपर पे दिखेगा. Make SOPs. Because SOP जब रहता है ना, तो top to bottom 1, 2, 3, 4, 5 सामने रहता है. You know that this needs to be followed. So these are structured formats which need to be done. Every time you will not be there. Every time you will not be able to see. So that your subordinates also develop that habit in that institute or in that hospital to work that way. Very important. Have clinical audits. Not after you have a problem. Have clinical audits. Critical patients हो गए, जिसका CPR हो गया, जिसका ICU patient है, critical patients है, MLC cases है. उनके ऑडिट्स ले लीजिए, एंड मोर सो जो केसेस के बैड आउटकम्स आए हैं उनके तो डेफिनेटली ऑडिट करिए. Train your healthcare staff for documentation. Many places, the problem is not with the doctor, it's not with the paramedic, but the problem is with the clerical staff. जैसे पीसीपी एनडीटी में आपने देखा होगा, मैक्सिमम केसेस आर ड्यू टू क्लरिकल एरर्स, जिसमें डॉक्टर की तो कोई गलती ही नहीं है, सेक्स डिटर्मिनेशन का तो चांस ही नहीं है. सो दीज क्लरिकल एरर्स समटाइम्स कॉस्ट अस अ लॉट, वो देखना जरूरी है. Backup and securely store all the records. See that your records are within good control. And please remember, anything that is not documented is not done. आप कुछ भी बोलिए, कोई नहीं सुनेगा और आप उसको प्रूव भी नहीं कर पाओगे. सिर्फ अगर आपने डॉक्यूमेंट किया है तो ही आपको वो काम आने वाला है. सो मेनी अ टाइम्स जब प्रॉब्लम होता है, हम लोग एंटिसिपेट करते हैं, जब एक आउटकम आता है तो एंटिसिपेट करते हैं, बट एट दैट टाइम वी डू नॉट नो कि डॉक्यूमेंटेशन में एक्चुअली होना क्या चाहिए. So that is a time when you need someone to guide you, someone who can tell you कि क्या करें. So that is the time when a person like Apex can come in and help you. You just give them a call and you say कि ये documents हैं हमारे, एक बार आप check करा लीजिए. If there's something else to be added, something else to be done, we do it right now. Because once done, it cannot be met. So is a risk management company. रिस्क मैनेजमेंट जब हम लोग बोलते हैं ना, तो रिस्क मैनेजमेंट इज अ प्रिवेंटिव अप्रोच. प्रॉब्लम होने के बाद हम लोग जागे, उससे पहले यू डू इट. इफ यू आर हैविंग अ प्रोएक्टिव बैकिंग, यू नो कि एक फोन कॉल करके मेरे डॉक्यूमेंट्स वेरीफाई हो सकते हैं, आई कैन कीप इट सिक्योर्ड, देन देयर इज नो प्रॉब्लम. सो दैट इज वेयर अ रिस्क मैनेजमेंट कम्स इन. प्रोफेशनल इंडेमिनिटी हम सबके पास है, होना ही चाहिए, लेकिन अंडरस्टैंड प्रोफेशनल इंडेमिनिटी इज अ बैक पिक्चर आफ्टर द डैमेज इज डन टू हेल्प यू फाइनेंशियली. इट्स अ फाइनेंशियल सपोर्ट. इट इज लाइक हिंदी पिक्चर में पुलिस, हम दैट इज द पोजिशन कॉम्प्लीमेंट्री. बिफोर इट हैपेंस अगर आपने कुछ कर लिया तो दैट इज प्रिवेंशन इज बेटर देन क्योर. जस्ट लाइक हाउ वी डॉ.
Ma'am, your voice is breaking.
issue. Now am I clear?
Yeah. Now it's better.
So it's like prevention is better than cure. That's what we doctors always tell our patients. And I think it's high time with the consumer protection and so many things to answer that we have it for ourselves as well. So you need to have a risk management coverage which will actually help you before there is an episode. Even how to, if there is a problem, how do you mitigate the problem? So this is what Apex gives in difference to the indemnity policy. And here I would like to highlight one important thing. With the new Consumer Protection Act, what has happened is the patient can take service from you at Haryana and come back at Mumbai and file a case against you in Mumbai. You cannot leave your practice and come here. So you need somebody who would have a pan-India presence without you having to damage your daily practice and your mental peace. You get a proper backing. So that is what Apex as a risk management can do, because they have an holistic presence, all India presence. So they can, I think many more states must have been added. This is an old slide, but then definitely, just hello, huh? Anand. Okay. So we need somebody who will be there during, any kind of a focus that we need. क्योंकि क्या होता है जब कुछ स्ट्रेस आता है ना, उस टाइम पे हम लोगों को डर लगता है कि अभी किससे पूछे, किसको मिले, क्या करें. हाउ डू वी गेट द राइट ओपिनियन, हाउ डू वी गेट आवर डॉक्यूमेंट्स चेक्ड, हाउ विल वी अंडरस्टैंड दैट वॉट एवर डॉक्यूमेंटेशन इज डन इज गुड इनफ, या हमने कोई इंपॉर्टेंट पॉइंट्स मिस किया है. So these are certain important points which I would like to highlight. And also, again, I will say, your documentation is like a love letter you write to yourself, which will help you in future. Only thing, see to it कि आप उसको पढ़ पाए. Because writing legibly and writing the whole story is really very important. This is your story, your defense. And only this paper can say how much you have done and for your patient, how much effort you have put. So, with this very concise presentation, I thank you so much for your attention and giving me this opportunity to talk to all of you. If there is something more that we can discuss, I'll be more than happy. Thank you so much.
Thank you, ma'am, for the crisp and nice presentation.
Thanks.
Now, I would request the attendees to unmute themselves if they have any questions, and they can ask directly with the madam, or they can put their questions in the chat box. I'll ask those questions on their behalf. Ma'am, there is a question from one doctor that if a patient refuses to sign the consent, then how to proceed?
If the patient refuses, then you should not proceed. When you do anything unless the patient, until and unless the patient is a minor, patient is of unsound mind, patient is unconscious, so they're not able to understand what you are saying, so then you can take a guardian signature or something like that. But very frankly, at this point of time, with so much of allegations against doctors, I would not say that you should go ahead with any kind of procedure without a consent. In fact, a consent should be very precise. If you're taking it for a therapeutic reason, if you're taking a consent for a biopsy, please only do a biopsy and come out. Don't try to extend it. Or if you feel there can be bleeding, I mean, need to extend the surgery, then in the consent, you make it clear that I'm going to do a biopsy. If there is a bleeding, if there is a problem, I will need to, extend it. So this thing has to be done very clearly. Consent is an absolute requirement. Do not try to skip it.
There is one question from my side.
Yes, sir.
Confidentiality is basically, it is sacrosanct for our medical records. But whenever a patient has some Mediclaim insurance, then insurance companies ask for
The
documents.
documents.
And
Yes.
probably most of the times they don't come with a consent from the patient. So how to proceed with those requests, and if they don't have the consent, then should we supply them because they say that they are in contract with the patient regarding their Mediclaim, so they are authorized to get these records on behalf of the patient.
Whenever there is a patient who is actually coming for a Mediclaim, either reimbursement or a cashless to take a pre-authorization, when they say that you want to give it for the Mediclaim, then at that time, with the admission paper only, you take a consent from them, because you will have to provide the papers. नहीं तो उनका ही loss होगा. Then they will again come and blame the doctor only कि आपने पैसा नहीं दिया तो मुझे वहां पेपर नहीं दिया तो मुझे वहां पे पैसा नहीं मिला. So that one, is it okay now?
Yeah.
Yeah. So just take a consent additional. That is the only option that we have.
Can we ask the insurance company to provide us the consent from the patient?
Yes, you can.
Before supplying the documents to the insurance company?
Yes, you can. But you know what? उसमें फिर पेशेंट आके आप ही से झगड़ा करेगा, क्योंकि इंश्योरेंस कंपनी इतना प्रॉम्प्टली करेगा नहीं, उसका इंटरेस्ट है नहीं पैसा भरने में. It's better to take the consent from the patient during admission only.
There is a question from Dr. Krishan Kumar. Ma'am, I am a pediatrician. I explained all the things to the patient attendant. They said we don't sign this paper. In that case, should we send him? And how to document that? If a patient is serious and something happens to the patient, then again they blame us neglect. What to do in that scenario?
So there is something called as a negative consent. So regarding our pediatrician colleagues' question. Hello?
Yes, ma'am. Yes, ma'am.
Yeah.
You are audible now.
Yeah. So regarding his question, I would say that he can take a negative consent because he has explained everything. Write it down that I have explained all this. but the patient's relatives are not willing, and tell the patient's relative to write that we are not willing, and then refer the patient saying that they are not willing for anything. So for that, you cannot do anything. The patient's relatives do not agree and do not consent, then you don't have a choice.
Any other question from any other participant?
Sir, there is one more question from Farhan Usmani. Please take that question.
Can we get examples of some informed consents like that for CS?
See, what happens is any informed consent, there is only one protocol that you need to follow. Following all these 4 points, if you even make a blanket consent, there are a number of cases where the doctors have been considered, their informed consents have not been considered because it was a blanket consent. So, very clearly, when you are doing a consent, you have to just write these 4 columns in your consent: indication, what are the different options that you have given your patient, what are the complications that you can come across. If you're writing for CS, it's very common, you need to mention PPH, you need to mention OH, you need to mention all these things. So, yeah, and also there are protocols which are already available with a number of organizations. I think Foxy also has, MOGS also has, all of them have it. But then ideally for you, I feel you should not be using a blanket consent, but the consent should be a case specific one. So that gives more weightage to your consent.
Any other question from anybody else?
Can indoor paper can be given to the company person?
Which company person, ma'am?
Madam, somebody has that health insurance, no, and company person
Yeah, that is what we just
will not
discussed.
come, but the attendant and other person came for the indoor record.
No, no. See, if the insurance person is coming, that is what we just discussed before this, is always a patient say that हमारा mediclaim है या something like that.
हाँ, इंडोर पेपर मांग रहे हैं वो लोग, ऐसा बोलते हैं.
हाँ, तो उनको लिख के देने को बोलिए. When the patient is consenting to give your indoor papers, you can give. There is no problem.
Okay.
Patient का consent होना जरूरी है, बस that's it.
हाँ नहीं मैडम, वो ऐसे आते हैं कि हम कंपनी वालों ने बोला है
हाँ,
कि इंडोर पेपर लाके दो तो आपका वो क्लेम कंप्लीट होगा,
करेक्ट
अदरवाइज
करेक्ट करेक्ट.
ऐसा.
नहीं, लेकिन आप जस्ट उनको बोल सकते हैं कि आप रिटर्न में हम लोगों को एक एप्लीकेशन दे दो.
जी.
And once they give you the application in writing, attach it to the indoor papers and keep. कि
Okay.
अगर किसी ने पूछा आपको आपने कैसे दे दिया, तो this is the consent.
हाँ हाँ.
So
ठीक
then
है
that
मैडम.
can be done.
जी जी.
Ma'am, basically all
Thank
the
you, madam.
insurance companies have a standard consent form from the patients for divulging this medical record.
Information, yes.
Yeah. And willfully these insurance peoples, they create emergencies for the doctors and they don't supply it. If we insist, then definitely they are duty bound to supply this consent from the patient for giving the records. Otherwise we are not obliged to give the records legally or otherwise also.
It's only that we try to cooperate with our patients कि उनका पैसा है, चलो ठीक है, थोड़ा cooperate कर ले, that's all.
Yes ma'am. I think there are no more
मैडम,
questions.
एक पेशेंट कभी कंसर्न नहीं देते तो नेगेटिव कंसर्न नाम का भी कोई ऐसा था, मैंने
Yes.
तो पढ़ा है कि पेशेंट इज
Yes.
नॉट गिविंग कंसर्न देन टेक अ नेगेटिव कंसर्न कि
Yeah.
पेशेंट ना ये नहीं कराना मांग रहे हैं या ये प्रोसीजर हमें नहीं कराना है, जो भी
Yes, that is what
रिस्पांसिबिलिटी
I just said. That is what
Yeah.
I just said. Ki if they are not willing for any of your suggestions, you can take in writing that this is a negative consent. Patient is not willing. That is the reason we are not able to give the services.
Okay, ma'am. And what about printed consent, madam?
That's very controversial. It is still having stay in the Supreme Court, but ideally, I feel that in the long run, it will create trouble. So it's
Okay.
much better that you have. That is why I said a case specific consent is something that is really appreciated and accepted in the court of law.
No, suppose I am doing cesarean and obviously there is 3-4 most common complications. Is suppose
Yeah.
PPH and
Yeah.
you try natonic, you may landed
Yes.
into cesarean hysterectomy and all that.
Yeah.
That should be mentioned in complication.
Yes. Yes.
Added risk has written in a pre-printed consent form. Is it okay, or every time we have to
See,
take?
right now it's okay because the case is stayed in the Supreme Court. If there is if there is any outcome out of that case, then we'll come to know. Till then, I think they will I know accept it.
Okay, ma'am.
We
Thank you so
have
much.
a detailed discussion on consent on our academic Fiesta channel. If anybody has any questions regarding consent, then please refer to that YouTube channel of IMA Haryana Academic Fiesta. We have very detailed discussion on consent in one of our previous talks.
Sir, one personal question is this.
Yeah, yes,
Hello.
ma'am.
Sir, earlier I'm a gynecologist,
Yes,
and
ma'am.
earlier I was in indemnity policy from Foxy, no, ICICI Lombard. एट दिस टाइम मैंने ये अपेक्स वालों से लिया है, क्योंकि मेरे बहुत सारे कलीग लोगों ने कहा कि मैडम ये दिस वन इज बेटर, क्योंकि हम बात कर सकते हैं, या जो भी इनका वो है वो अच्छा है एपेक्स वालों का। तो फिर मैंने इस बार इनको लिया, बट वो बोलते हैं कि आपने जो 5-6 साल जो भी आपने दिए हैं वो आपके लिए नील हो गया। ऐसा ऐसा कुछ रूल है क्या?
Madam, medical indemnity is for 1 year only. If
नहीं
anything
सर,
happens
1
in
ईयर
that
के लिए
1
तो
year,
ठीक,
then
एवरी ईयर हमने
only they are
4-5 साल
liable.
जैसे दिया, तो सपोज 4-5 साल पहले कोई ऐसा कुछ हुआ होगा, टचवुड अभी तक ऐसा कुछ हुआ नहीं है, बट ऐसा कुछ होगा तो बोलते हैं हम उसको उसमें नहीं लेंगे, वो हमारा आपने जो 5 साल 6 साल जितना भी आपने पे किया वो नील हो गया। ऐसा ऐसा होता है क्या?
उसको मैम रिट्रोएक्टिव बोलते हैं। रिट्रोएक्टिव तो आई थिंक नो कंपनी इज प्रोवाइडिंग, दे आर ओनली प्रोवाइडिंग फॉर ओनली द इंश्योरेंस पीरियड।
नहीं सर, अभी मैंने सपोज पिछला मतलब 2000 का मैंने लिया है सपोज, है ना, और 2000 में कोई केस होगा और अभी 2026 में आएगा या 25 में आएगा, तो फिर वो 2000 वाले जो मैंने पे किया वो नील हो जाएगा सर?
वो अपेक्स वाले बताएंगे या मैम बताएंगी? मैम यू आर
I
म्यूटेड।
think that only the company can say. I mean, I will not be able to speak on that.
हाँ, क्योंकि ये थोड़ा सा कंट्रोवर्सी हो रहा था ऐसे
सर,
में कि
इंडेमनिटी इंश्योरेंस इज अ इवेंट बेस्ड पॉलिसी। तो ये जब भी क्लेम रेज होगा, जब भी केस दर्ज होगा, वो वाला पीरियड है। अभी आपका अपेक्स का है तो अपेक्स विल हैव टू कवर, बिकॉज आप अभी द क्लेम या इवेंट हैज अकर्ड नाउ, अब आ रहा है ना उसका क्लेम।
नहीं सर,
पहले
इसमें एक
नहीं
चीज
सर,
और है, आपको रेट्रोएक्टिव डेट मेंटेन करनी होती है। जब आपने अपेक्स की तरफ स्विच किया तो आपको रेट्रोएक्टिव डेट मेंटेन करनी है। अगर वो आपकी मेंटेन है तो सब कुछ कवर है। आप इस मीटिंग के बाद मैं आपसे कांटेक्ट कर लूंगा और मैं आपको क्लियर कर दूंगा सारी चीजें। रेट्रोएक्टिव डेट मेंटेन करनी होती है जब भी आप स्विच करें किसी भी कंपनी की तरफ, यही
सर
है
तो
बस।
उसमें वो क्या होता है सर, कैसे क्या मेंटेन कर, जो उनकी जो फॉर्म है वो अपने को रखनी पड़ती है, ये वाला ना?
नहीं मैम, मैं बिल्कुल आपको सारी चीजें क्लियर कर दूंगा, कोई दिक्कत नहीं है।
जी
मैम
जी
उसमें
मैम।
जब भी आप पॉलिसी लेंगे तो उसमें रिट्रोएक्टिव पॉलिसी डॉक्यूमेंटेशन में रिट्रोएक्टिव डेट मेंशन कराएंगे तो ओनली आपका रिट्रोएक्टिव
यस।
कवर होगी, अदरवाइज कवर नहीं होगी। और
अच्छा, क्योंकि
एक इंश्योरेंस कंपनीज और गड़बड़ झाला करती हैं। आई डोंट नो अबाउट दिस पर्टिकुलर कंपनी बिकॉज माय एक्सपीरियंस विद AICL वाज अगेन वेरी गुड, बट
ICICI Lombard sir, earlier I was with
मैम बेसिकली
ICICI Lombard.
what they do that deductions, so we have to be very careful about self deduction amount, because to sell the policy at a cheaper premium, what they
हाँ
do that they give self deduction of amount of suppose rupees 10 lakhs. So if
हाँ,
you have a case of suppose karo 20 lakhs, so 10 lakhs will be paid by you if you have
ओके,
opted for self
हाँ,
deduction policy. So you have to be
अच्छा,
very careful to read all the policy documents before making the payment. And if you find anything even after payment, then you have to raise the question with the insurance company, because otherwise we doctors are very poor in reading the
यस सर,
documents. So we have to
पढ़ते
read
नहीं है सर।
all the documents very carefully.
बस वो कंपनी वाले आते हैं, यहाँ साइन कर दो वहां साइन कर दो, बस हो गया।
No, ma'am, we have to be careful ourselves, otherwise we are
हाँ
definitely bound to lose so many things.
जी सर, जी बस सर वही पूछना था, क्योंकि वो मेरे को बार बार
तो
फोर्स कर रहे थे, आपने इतने साल प्रीमियम दिया और आपकी जो वो होगी वो पॉलिसी नील हो जाएगी, फिर आप क्यों स्विच ऑफ कर रहे हो ये वो।
नहीं मैम, वो तो देखो वो क्या है, जैसे आपने उनकी पॉलिसी छोड़ के एपेक्स को ऑप्ट किया ना, तो वो एक
हाँ
तरह से ये उनका गेम भी होता है कि आपको डरा के, ताकि आप उनको प्रीमियम पे कर दें। मेरे को बिल्कुल मतलब श्योर है कि आपने जो हमारे रिप्रेजेंटेटिव मिले होंगे उन्होंने आपकी रेट्रोएक्टिव डेट मेंटेन की होगी, फिर भी मैं चेक करके कल आपको मिलता हूँ मैम।
जी
वो
जी
तो
जी
आप उसी पॉलिसी से
ठीक है।
लेते हो ना,
दूसरा जो है सर, ये तो कंपलसरी एक्सेस की बात कर रहे थे,
तो आपने
तो
ठीक कर दिया
कंपलसरी एक्सेस हमारी पॉलिसीज में नहीं है सर।
या
तो जो वो
I
ये जो
know that.
रेशो वाला बात कर रहे हैं या कंपलसरी एक्सेस, दो ही चीजें बात कर
कंपल्सरी
रहे हैं सर।
एक्सेस की बात करो, कंपल्सरी
यस सर, यस सर। हाँ, तो वो नहीं है सर इधर इस पॉलिसी में, हमारी साइड एपेक्स पॉलिसी में।
थैंक यू सो मच सर, ये बस मेरे को थोड़ा सा क्लियर हो जाए, नहीं तो फिर वो बोल रहे थे मैडम आप तो दो जगह भी आप अपनी पॉलिसी दे सकते हैं। मैंने कहा ऐसे एक पर्सन की दो पॉलिसी कैसे हो सकती है?
नहीं हो सकते मैम।
नहीं, आप मेरा एक नंबर नोट कर लें, आप उस पर कॉन्टेक्ट, मैं आप मेरे को जस्ट एक रिंग दे दें, मैं पूरा डिटेल निकाल के अभी कॉल कर लूंगा मैम आपको।
जी जी
9215580932।
9215580932। जी थैंक यू सर।
मैम मेरा नाम राजकुमार है। अब मैं एक जस्ट रिंग दे दें, मैं आपको पूरी डिटेल्स निकाल के आपको कॉल करूंगा मैम।
जी सर, जी जी, थैंक यू सो मच
थैंक यू
सर,
मैम।
थैंक यू सो मच।
So I think there are no more questions.
थैंक यू डॉक्टर विद्या। मेडिको लीगल इश्यूज पे तो जितने मर्जी टॉक करवा लो सर, कम ही पड़ेंगे।
सही
we
है।
doctors may be good at treating, but we are bad at medical legal issues. We need to get our information on these things and maintain proper records. Thank you, participants. Thank you, the speaker, for a nice talk.
On behalf of IMA Haryana, thank you very much.
Thank you, sir.
Okay, thank you.